Diagnosis 101, your guide to wellness. Welcome to our medical channel. Today, we'll delve into a serious and life-threatening condition that demands our attention: blood poisoning, also known as sepsis. Sepsis is a medical emergency that arises when the body's response to an infection damages its tissues and organs. Initially, it might seem like a regular infection, but sepsis rapidly escalates into a critical condition that can be fatal. Before we continue, if you find this information valuable, consider subscribing to our channel and clicking the notification bell, so you never miss any of our latest medical insights. Now, let's take a fascinating journey back in time to uncover a strange historical fact about blood poisoning. In the 16th century, an Italian physician named Leonardo Fioravanti observed peculiar symptoms in his patients suffering from severe infections. He noticed that a few of them showed signs of delirium, confusion, and disorientation. Little did he know that these were indicators of sepsis affecting the brain, now termed septic encephalopathy. In the early 19th century, blood poisoning, sepsis, was often treated with an unconventional and eyebrow-raising method known as therapeutic cannibalism. During this time, physicians believed that consuming small amounts of human flesh or blood from a deceased person could cure various ailments, including sepsis. This bizarre practice was based on the misguided notion that ingesting tissues or fluids from a deceased person would transfer their strength, vitality, and healing properties to the living. As gruesome as it may sound to us today, it was a widely accepted medical treatment at the time. One infamous example of therapeutic cannibalism occurred in the early 1800s when the Austrian anatomist and physician, Joseph Leopold Auenbrugger, propagated the idea that consuming small pieces of the heart or blood of a fallen soldier could help treat soldiers suffering from sepsis or other battlefield-related illnesses. Fortunately, as medical understanding and knowledge advanced, such practices were abandoned and replaced with more evidence-based and effective treatments for sepsis. Today, we can look back at this historical fact with a mix of fascination and horror, appreciating how far medical science has come in the treatment of life-threatening conditions like blood poisoning. Recognizing the symptoms of sepsis is crucial for early intervention. Look out for signs like fever, rapid breathing, elevated heart rate, extreme fatigue, and altered mental status. If you suspect sepsis, seek immediate medical attention. Sepsis can be caused by various infections, including pneumonia, urinary tract infections, and skin infections. Certain factors increase the risk of developing sepsis, such as a weakened immune system, chronic illnesses, or invasive medical procedures. Timely treatment is vital in combating sepsis. Medical professionals will administer antibiotics, oxygen therapy, and intravenous fluids to stabilize the patient. Preventing infections through good hygiene and vaccinations can also significantly reduce the risk of sepsis. Early detection of sepsis can be a lifesaver. If you or your loved ones experience signs of infection that don't improve or worsen rapidly, don't hesitate to seek medical help. Remember, the information provided in this video is for educational purposes only and should not be substituted for professional medical advice. If you suspect sepsis or any other medical condition, please consult a healthcare professional immediately. Sepsis is a severe medical condition that requires immediate attention and intervention. By staying informed and vigilant, we can play a significant role in preventing the devastating consequences of blood poisoning. Diagnosis 101. Stay curious, stay informed, and stay healthy.